Endoscopic polypectomy has become a standard procedure for removing polyps and is effective in reducing the incidence of colorectal cancer. The procedure is associated with complications such as bleeding, perforation, and post-polypectomy coagulation syndrome. Post-polypectomy bleeding is the most common complication of colonoscopic polypectomy, with an incidence ranging from 0.3% to 6.1%. The risk of bleeding is higher after the resection of pedunculated polyps due to the presence of a large artery in the stalk. When large pedunculated polyps were resected without taking any precautions to prevent bleeding, the bleeding rates were reported to be approximately 10 to 15.1%. Several preventive methods, such as injection of epinephrine into the stalk and application of an endoloop, a detachable snare, have been developed for the management of post-polypectomy bleeding. The efficacy of the prophylactic clip has not been confirmed. No randomized trials have been conducted to assess the effectiveness of prophylactic clip for the prevention of post-polypectomy bleeding for large pedunculated colonic polyps. In a prospective, randomized, non-inferiority study entitled Comparison of Prophylactic Clip and Endoloop Application for the Prevention of Post-Polypectomy Bleeding in Pedunculated Colonic Polyps, a prospective, randomized, multicenter study, G et al. Compared the efficacy and safety of the prophylactic clip and endoloop in the prevention of post-polypectomy bleeding. Here is a summary of their findings. Patients and methods. Study design and patient population. This was a prospective, randomized, multicenter, non-inferiority study conducted at the following 6 hospitals of the Catholic University of Korea: Incheon St. Mary's Hospital, St. Vincent's Hospital, Daejeon St. Mary's Hospital, Bucheon St. Mary's Hospital, Uijeonbu St. Mary's Hospital, and Seoul St. Mary's Hospital. The study protocol and participation in the study were approved by the Institutional Review Board. Written informed consent was obtained from all patients. Background and study aims. The effectiveness of the prophylactic clip for the prevention of post-polypectomy bleeding in pedunculated colonic polyps has not been confirmed. The aim of this prospective randomized study was to compare the efficacy of prophylactic clip and endoloop application in the prevention of post-polypectomy bleeding in large pedunculated polyps. Patients and methods. A total of 195 patients who had pedunculated colorectal polyps with heads larger than 10 millimeters and stalks larger than 5 millimeters in diameter were included in the study between July 2010 and January 2013. Polyps were randomized to receive either clips or endoloops. Both devices were applied to the base of the stalk before conventional snare polypectomy. Bleeding complications were analyzed with a non-inferiority margin of 5%. Results. A total of 203 polyps were included in the study, 98 in the clip group and 105 in the endoloop group. Bleeding occurred after 5 polypectomies in the clip group, 5.1%, and after 6 in the endoloop group, 5.7%. Non-inferiority of the prophylactic clip to the endoloop could not be confirmed. Absolute bleeding rate difference, 0.6%, 95% confidence interval, 5.6% to 6.8% because of small sample size. Immediate bleeding episodes occurred in 4 out of 5 polyps in the clip group and 5 out of 6 polyps in the Endoloop group. Delayed bleeding occurred in 1 polyp in each group. Conclusions. These results suggest that the application of a prophylactic clip is as effective and safe as an endoloop in the prevention of post-polypectomy bleeding in large pedunculated colonic polyps.